They're great for lots of things.
Yeah.
And on the male side, there's a lot more sensitivity and stuff.
Oh, okay.
And so,
Good for them.
yeah, give us something.
Yeah, I like it. And great for anal. Okay, moving on. Next question.
This is Sexy Funny Raw, where we chat all about the world of sex, from dating and relationships all the way to the adult industry itself. I'm Silvia Saige, and this is my Pornspective, answering all the questions you weren't even brave enough to ask Google. Get ready, because Sexy Funny Raw starts now.
What's up, guys? Welcome back to another episode of Sexy Funny Raw. I am your host, Silvia Saige, joined in studio, new studio, with me, of course, is Dr. Eddie, my co-host. And obviously, you guys can tell we're doing things a little bit differently. So when it's just Dr. Eddie and I in studio, I want to get really technical because we have you here, right? And so I feel like if we're not using you for the exact thing that you're bringing to the table, what is the point, right? So I want to make sure.
Use me, Sylvia.
Yes, want to use you. But I feel like that because sometimes on some of our other episodes, we were talking a lot about porn stuff, and a lot of times you couldn't really get in there with the public health perspective, and
Agreed.
you couldn't really bring us knowledge.
It was fun, though. I learned so much.
Well, of course, but I want to make sure that when you are here, we are utilizing you for exactly what you are.
I think more people should do that with me.
Thank you.
Use me to the fullest extent of my ability.
That's what we're going to do. And we have so many good questions from our audience that we didn't get to last time.
Definitely.
So we're going to dive back into those today. Let's get started. First and foremost, first question, should adult men consider circumcision?
So this is a complicated question,
Yeah.
Only because if it's having a negative impact on your sex life and your mental health, then that's something to have a conversation about with your physician, right?
Yeah.
So with your doctor. If it's not doing that and you're doing it solely for the possibility of like infection reduction.
Yeah, I was going to say a lot of people, I think, feel cleanliness is the issue.
Sure. And so there are instances where being circumcised will reduce infection possibilities. What I'll say with that is if you practice good hygiene and all of those kind of things, it's not so much an issue, and the reduction isn't significant enough in most cases that the healing, surgery, and requirement of an adult male being circumcised is quite different from a kid.
I guess maybe I'm a little ignorant to this. So what is the infection that they think they're avoiding by having the circumcision? What can cause what? I guess all I'm thinking is it maybe gets a little sweaty or a little.
Well, there's vaginal fluid or fluids in general that
Okay.
could be there and can get trapped under the foreskin.
Okay.
And so if you're not bathing right away and you don't have access to soap and water, which is a lot of places on the planet, then it could, of course, be an issue.
Okay.
If you're practicing pretty good hygiene, then the chances of it being reduced aren't so much for things like, so it's going to depend on what it's actually reducing, right?
But that's what I'm saying. Like, it's not going to stop you from getting an STI. It's not going to do any of those things, whether
No.
you're circumcised or not.
Right.
So I guess when I'm thinking infection, if you're clean, either way, you're avoiding the infection.
I mean, avoiding unsafe sex is going to expose us to all of these things. If you're uncircumcised and you're not practicing really great hygiene, then the chances do go up because that vaginal fluid or whatever kind of fluid we're talking about can certainly get trapped there, which creates an environment with micro tears and stuff, which happen during sex naturally.
But are you telling me that a circumcised man wouldn't have that same risk?
Absolutely has that same risk.
Okay.
There has been some studies done where if you're circumcised and you have HPV, the chances of getting penile cancer go down. But the percentages of men that get penile cancer are quite small.
I don't think I knew there was penile cancer until just this
There is.
moment.
Yeah, well, and penile
Okay.
cancer awareness is its own kind of universe, and a lot of men don't know about it. And so there's a lot of
women
campaigns.
don't either.
Yeah, it's absolutely a thing. Generally, a lot of people don't know about penile cancer, and so increasing awareness is super important, and
Yeah.
that might be its own kind of conversation.
Okay.
Certainly for men, you don't you don't really encounter it. You don't get a lot of information when it comes to that stuff unless you're experiencing
What
it.
are signs of penile cancer?
It could be a variety of things. And if you see any specific marks or pain or bulges,
Really?
the problem is that you really have to see a professional when it comes to something
Okay.
like penile cancer. You can't self-diagnose and stuff.
Do you see it from the outside?
So it's going to depend. It depends on where it is.
Huh.
It could be in the foreskin. It could be under the foreskin. It could be in an area that you might not even know this. The numbers for penile cancer are really, really low.
Okay.
But it does exist and it does happen.
Yeah.
So there is a kind of, when we're talking about something like HPV, there is a direct relationship with cervical cancer for women and definitely penile cancer as well.
I guess now I want to do a whole episode on penile cancer because I have so many questions, but okay, we'll just stick to your guys' questions for now. I'm like blown away
There's a
by
lot to
this.
know. There's a lot to know. Yeah.
Okay. One last question on penile cancer, just because I'm so curious. Does your dick fall off?
It does not fall off, but like a lot of cancers, depending on the severity, depending on what's going on.
Well, like with
and where
breast,
it
they would
is.
take your breast away.
Yeah, and so they could have to take pieces, right? Okay. And so, ultimately what you need is a functioning, right? And so where does function come in and not, and what's the necessity, and
Wow.
how do you rate life over having a penis at some instances, right? But
I mean,
might not
I don't
even
have
get
a
to that.
penis and life is fine, but I like penises in my life. So, yeah.
I mean, most guys like their own,
Yeah.
right? And
Yeah.
so that being said, we have to check, we have to be careful, and we
Yeah.
have to, like, men are generally overall worse at getting care, right? We don't
Yeah.
seek care, and it's really tied to like Western ideas of masculinity and all of that kind of crap.
Wow.
And so single men even worse because they don't have a wife or a husband or whatever the case may be
Yeah.
to tell them to go to the doctor if something
Yeah.
is off, right? A lot of men kind of put things aside.
Of course.
And
a lot of people in general put things
definitely,
aside.
definitely.
Absolutely.
And
Yeah.
so putting something aside, it could easily become 2 or 3 years where something could have been done.
I thought I would never be one of those people because of how open-minded I am, but I just went to the doctor for a mammogram and she was like, "Is that it?" And I was like, "Yep." And I was like, there wasn't it. I had more things I wanted to tell her, but I didn't because I was embarrassed by the things I had to say. And because it wasn't why I was there, but different story.
That's fair.
Okay. So to answer the question, the simple answer is going to be no.
The simple answer is no, but it really depends, right? So there
Yeah.
are specific things, like if the foreskin is too tight, there's specific medical reasons
Okay.
that people sometimes go for it. So if you
Okay.
can't pull the skin when erect behind the head, that might be a reason. So they do different kinds of circumcisions in that case, where it could just be like a little bit of a cut along the top so that it can get back, because pulling it back is going to be critical
Okay.
when we're talking about something like hygiene.
Okay. But in general,
But in general,
good hygiene
right?
will still keep you just as safe, right?
Mostly, absolutely. Hygiene is a really big concern, and we also live in an environment where people don't have those conversations. And it's like almost 80% of people in the U.S. are circumcised, and so that's a really large percentage. And so the people that aren't don't have a lot of exposure to it,
Yeah.
and there's not a lot of education on it, and
Yeah.
people feel very nervous about having those conversations with their kids.
Yeah.
And so all of those things are kind of lumped together here in the U.S., where in other parts of the world where circumcision is rare, most other parts of the world, circumcision is quite rare. Those conversations are pretty normal.
Yeah.
And even if they're very, very conservative, hygiene kind of comes along with that,
Yeah.
right? And so that's a complicated kind of piece to that.
Yeah.
And so, but I think if we talk about it and people become comfortable with
Yeah.
it, another kind of slight piece to that is that a lot of women aren't comfortable with uncircumcised men because they don't have a lot of experience. And so if you go online or if you're on one of the dating apps, people put those things in those apps saying like uncut or cut only,
Wow.
all of those kind of very, very specific things.
Yeah.
For whatever reason that they're putting it in there. And so that could create an environment where a man doesn't feel comfortable with his own penis,
Wow.
right?
I can honestly tell you, I mean, obviously now I've been with both circumcised and uncircumcised, but growing up in the Midwest, I never had seen an uncircumcised penis. And so it wasn't that I was like afraid of it, but I just didn't know anything about it. And so it was just different.
It's
I
just
guess.
different. Absolutely.
Yeah.
Yep.
But now I tell everybody they're the best for anal. So, I mean,
They're great for lots of things.
Yeah.
And on the male side, there's a lot more sensitivity and stuff.
oh, okay.
And so,
Good for them.
Yeah, give us something.
Yeah, I like it. And great for anal. Okay, moving on. Next question. Okay. Question number 2 is going to be from a woman, and she says, I noticed a bump on my vagina. Is it an STI?
So the only way to know if there's an STI is really to go to your doctor and get tested. If you are concerned, you should absolutely go. That is making a couple of assumptions. You have access to healthcare. You have access to a doctor. There are lots of places where you can get STI testing, Walgreens, CVS here in the US, right? And so, but those are expensive and usually per test. So they'll test for gonorrhea, you have to pay for that. Most public health departments in a lot of cities in the US do have free clinics and do provide care in those instances. So if you type in kind of free clinics in whatever city you're in, that could be super helpful. The other question or the other kind of follow-up to that would be, are we talking about the vagina or are we talking about the vulva, right? Because those are going to be different, the vagina being the internal, right? And so that internal, if we're talking about spots internally, that's potentially going to be very different than a lot of the other possibilities externally, right? Because it could be an ingrown hair. There's a lot of different possibilities when we're talking about externally, whereas internally, there's fewer.
Okay.
Theoretically. So it really depends on which one it is that we're talking about.
Yeah. Because I think a lot of times too, and this is one of the things that we talked about is like folliculitis, just the root of the hair being infected and causing a bump that would be raised. It might look infectious, but definitely is not, maybe you just need a better razor,
Well, and so it's really easy for that root area to create a space that allows bacteria in. Those areas, especially that general region, is sweatier than other parts of the body. It's harder to stay clean. All of those things allow bacteria all over us. I mean, we're covered in bacteria anyway, but certainly there's specific bacteria in certain areas that are more sensitive because of moisture and things like that. So it's pretty common.
Yeah. If this person were to go to a doctor and say, oh, I have this bump, what is it? I don't even feel like the doctor would look at the bump per se. They'd probably just give them a blood urine test, right?
No, it depends on, the doctor would probably want to look at the bump. Because if it's bacterial, then you can go like the antibiotic route potentially. It depends, right? And so you don't want to take antibiotics unless you have to, right? And then there's very specific things, and we've talked about antibiotics before. But if it's internally, it could be a cyst, so a doctor would need, your OBGYN would probably
So definitely get to a doctor. Don't even do this. I wouldn't even suggest the self-testing then. Just go straight to the doctor.
I wouldn't either. If you're concerned that it's an STI, that's different, right? So if you've had potential exposure and stuff like that, then absolutely. I think, and we've said this a million times, if we followed what they do in the adult film industry, which is just get tested all of the time for things, it would clear up so much.
Yes.
But since we don't do that, and instead we stigmatize everybody in the adult film industry for doing that, then it becomes an environment where that's a first line of defense would be if you can't get to a free clinic, or if you do have access and you can do a home testing for a lot of things, which I know that we recently discussed herpes. A lot of those tests don't test for herpes.
Of course.
So there's that. So having access is going to be one of the biggest variables. And so I don't want to always talk about only the US, because we have an audience from all over the world. And so, it really depends on if you have access. That becomes problematic in incredibly conservative places where these kinds of conversations don't even happen.
Okay.
Right. And so home testing is not an option depending on what country you're in.
Yeah.
And so then that really does limit you. And so I don't necessarily have a solution to global health right now, but I'm working on it.
Working on it. Yeah. Okay. But don't self-diagnose is the biggest takeaway from this.
I think every physician that I work with would probably say that as from the get-go.
Yeah. Don't WebMD yourself. Don't Google yourself.
No, it usually creates more harm. But there are a couple of things that you can do, right? If you think it's an STI, kind of go down that checklist and then say, okay, maybe it's a cyst or something and I need to see my OBGYN or my physician, or if you don't have access to an OBGYN, go to a clinic. Yeah.
Okay. Good advice. All right. Moving on. Next question is going to be so many pages. Okay.
There are a lot of pages.
Okay. Now this is a good one. I'm no longer having, not me, our writer, no longer having morning erections. Should I be concerned?
So this is an interesting question because that changes
With age.
Yeah. Over time, you either might not notice them all the time, or you might have one before you even wake up, and then when you wake up, that whole process, depending on what's going on for you. However, there are a bunch of instances where that does happen. So if you have erectile dysfunction in your day-to-day life, right, where you're taking Viagra or whatever the case may be, then yes, those are often really related. So you'll have less morning erections if you have ED. Otherwise, it could be hormones that change as we age.
I was about to say, is there a stress factor to that at all?
I mean, for men, all of those things can be really, really tied together. And so if you're noticing that you're not having it and it is stressing you out, then it's going to just make it worse.
Okay.
Right. And so I think that's probably a conversation to have with your urologist as a man, or your physician, right?
I guess my question is, so the morning erection, I guess, that's what's worried this person the most, is because you just wake up with them. It's not necessarily like you wake up and you have a horny thought and you have a erection. You just wake up with a hard dick.
Right.
And so this person is no longer waking up like that.
Sure.
Is this an every morning thing for every man as long as he lives every day?
Most mornings.
Really?
And when it doesn't happen, you notice it because it's unusual.
Yeah.
Right. But usually that's it's lumped
What
together.
age does this start?
Teenage years. Puberty.
So, okay, puberty. Okay.
Yeah. But in puberty, everything gives you an erection, right? And it could be incredibly random, and and in some cases it has nothing to do with excitement.
Yeah.
So excitement, of course, but it could be just random because our bodies are changing drastically and our hormone levels are changing at that point. And so erections are part of our hormones, or they're definitely tied together. And so.
Interesting. This is not that question, but only because we're talking about boys and their boners. My best friend has a 10-month-old, and she just had his first boner for the other day opening a diaper, and she was like, it was very surprising, I will say, because it's her first boy. And she was like, I was very caught off guard, didn't know how to handle. I also didn't know that babies had erections.
They do. That's less hormone related and more if it rubbed along the penis and stuff like that. Any kind of rubbing or touching in that area. We'll just do it.
We'll just, without even a thought in the brain, your penis just sends its own messages.
I mean, sometimes it has its own.
Yeah.
It has its own way of working.
Yeah.
And when we're talking about infants and stuff, there could be a variety of reasons too.
Okay. Yeah. I didn't know they had that power, I guess. In my mind, in my mind, I thought that like around puberty is like when your penis starts getting hard and you're like, oh, I found this thing, I should touch it. That's not the case.
Let me tell you that boys find their penises before puberty.
Okay. Well,
in most cases.
Okay.
Puberty is when some of the bigger changes happen.
Yeah.
Where you ejaculate and orgasm and kind of all that kind of stuff.
Okay. Yeah.
But you can touch it, play with it, get it hard. All of those things happen for young boys too.
Do you still enjoy the touching it?
You do enjoy the touching it, but you don't know that it's bad until someone tells you. And so,
because it's not bad, but okay.
Agreed. And what usually ends up happening is during those times when you're just touching it and stuff, if mom or dad or someone says you can't do that, that's bad, instead of saying that's not what you do here, do that in private, right? However you kind of approach that is going to have an impact on that young man as he gets older.
Yeah. Right?
And because that's like the first time you have experienced shame in that arena. And so we can often, and I'm not a psychologist, so that's a different area, but you carry that with you forever.
So what age would you say then is a kind of a natural progression for that morning boner to slip away?
So the other variables that really impact it are going to be things like high blood pressure.
Really?
So if you have high blood pressure or obesity.
Your blood's going other places?
No, well, high blood pressure, less to do with that. And can be very serious as we get older,
of course,
right? So cholesterol, blood pressure, all of these things are killers, especially in the U.S. Well, everywhere. Really.
Everywhere,
But all of these things are going to have impacts on getting erections during sex, the same way that they're going to have impacts on erections and our regular morning erections. There was a time where everybody was like, oh, well, we get an erection so that we can hold not urinating, right? Because you can't do both at the same time in most cases.
I've heard you could.
Right. You can.
Yeah, you got to hold it, right?
You have to really work at it. There's some work that goes into that.
Okay.
And there's in the industry, there's a whole area where erect penises are urinating inside and everywhere.
Yes.
Yeah. And so that being said, though, any of those things that would impact erectile function also can start to impact morning erections. But it doesn't necessarily mean it's bad, though.
But there's not like a certain age that would like kind of tell you.
No, because men can get erections and totally function very, 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 very late in life.
Okay.
So reproduction can happen until very late for men as opposed to women.
So what you're telling me is if he is waking up without a morning erection, there is something going on.
It could be regular hormone change, or it could be something else. And so,
but he could go and fix the hormone changes and get back the.
You can. Is it impacting you in a negative way? How often is it happening? Is it never again a morning erection? These are things that I'd want to know, right? So that I can take that information to my doctor, my medical doctor, and say like, right? In public health, we don't necessarily deal with like the nitty gritty of in the patient encounter. But understanding that, why don't you track it for a little while and see, is it no more all the time, or is it, hey, I'm getting them a little bit less or a lot less? And then that's information that your physician would know or want to know.
Okay, good to know. Should I get the HPV vaccine?
I think it's a really important question. And there's so much controversy around the HPV vaccine. So the HPV vaccine controversy is about having that conversation with young kids. Because you can get it from like 9 to 13 for girls, 15 for boys. And so it becomes having that conversation with children about future sexual.
But would you necessarily have to have the sex conversation with the child for them to go and get a vaccine?
Well, I think everybody having agency is really important and being able to make their own decisions to a point. I think that would be challenging at 9. But maybe less challenging at 13.
But my whole thing is if it's keeping your kid from getting some sort of cancer, whether that be a cervical cancer or now I know a penile cancer, I don't understand how it's like taking away their agency because you're like, I'm going to make this a better outcome for you. So I just don't, it's the same as like when everybody was going to get the corona, the COVID vaccine. My 6-year-old little sister is getting that vaccine. Yeah. And it's not like we're telling her like, well, do you want to get the vaccine? No, you're going to get the vaccine because you have to go to school and school is requiring it. So it's just crazy to me that that's even an argument for parents.
I agree 1,000%. Yeah. And really the ultimate simple answer, which I had kind of was working towards, is yes, you should absolutely get it. It's been around for about 15 years. It's really well proven. It works really well. No, there hasn't been any data on anything bad happening. It's been tested extremely well. And so not to say that others aren't, right? Because they typically are by the time they get to us. The benefits outweigh the negatives. And so that is...
What are the negatives, by the way?
The negatives of not getting it?
The negatives of the vaccine. Are there any?
I mean, you like any vaccine, you can have discomfort and kind of stuff like that, but nothing really that I'm aware of, right? And so maybe when they started it, but it's changed and they refine these things as we go. And it's been around for a really long time at this point. And so that's for kids. What I will say about adults, though, is that most adults at this point have probably been exposed to it. And so they're like, if I've already been exposed to HPV or if I already have it, should I get it? So that's a slightly different question than if I should get the vaccine. What I would say about that is yes.
Oh, okay.
You should, but you're only really, so they extended the age that you're allowed to get them from 26 to 45. So that was a huge change and that's fantastic. It doesn't work as well when we're older and you have to get 3 shots instead of 2, you are protected. What I will say about this, and this is the most important part, is if you get it, it protects you from other strains or strands of HPV.
Not what you already have.
Correct. Well, so if you have it, and that might not be the strain that leads to cervical cancer, getting it will protect you from cervical cancer, which is one of the biggest reasons to get it.
Interesting. So there are different strains within...
With everything. Most things have different variations there, even COVID, right? So there's different variations that happen and mutate, and that's just the natural order of it. And so one There's also 2 strains of HIV. There's HIV-1 and HIV-2, but that's a different conversation.
Yeah.
Not getting it doesn't protect you from getting cervical cancer, and that's really the go-to.
Yeah.
And for men too, the percentage of men getting penile cancer is a lot lower.
Okay.
But HPV and the relationship to cervical cancer for women is quite high.
Okay.
And so I
yes,
can't see a
get it.
reason. Yeah, it's a yes.
Okay. And I could still get it, which is interesting because I did
Definitely.
not think that.
Well, I mean, you're only 24 anyway.
Yeah, of course. Yes, I am. Yes, I am, Dr. Eddie. All right, last question.
Yeah, this is a good one.
A very important one also.
Yeah.
What is PrEP and who should be on it?
I wish it was in the water, to be brutally honest.
I do as well.
However, there are some things, right? And so,
well, let's explain what PrEP is.
Absolutely. So it's pre-exposure prophylaxis. And so when they were designing HIV meds, they realized that if you take 2 specific ones out of like the 3 cocktail that they used to do, you can be protected from it. Your body won't allow HIV in to replicate. And so it protects you from, even if you've had unprotected sex, right? Which is usually what's happening lately. And protects you from getting it even if you have sex with someone. There's 2 different types. Well, now there's 3 because there's an injection that you can do. But there's 2 main types. One that's been tested on men and women, and one that hasn't been tested on women just yet. And then the shot, I believe, I'm not sure if you were born female, if it works at this point, right? Because that's very new though. And so the benefits of having it are if you're in a relationship and you don't know if your partner's being faithful or anything like that, it gives people a lot of agency in protecting themselves. On the flip side of that, it's expensive if you don't have access to health care.
Yeah.
It's expensive if you don't have health insurance. Most insurances and Medicaid and things like that do cover it.
Yeah.
But if you don't have access to any of those things, then it's a problem. If you go to a lot of LGBT clinics, even if you're not LGBT, then you can have those conversations and you could get access in a lot of clinics, depending on where they are and all that stuff. So what I'd also like to say is that it's not available everywhere either, right? So it was approved in the US, it's approved. So like a lot of countries have ramped up PrEP use, right?
Okay.
So like Kenya and South Africa, places that often also have high
numbers.
HIV rates. It's also available in Europe, but it's not available in parts of Asia. So there's a lot of places where it's not available. So people have been doing, it's called medical tourism, where you go somewhere else to get treatment of some kind, whether it's plastic surgery or medicine. In the US, they've often been doing it with Canada because you can get prescriptions a lot less expensive and all that kind of stuff. And so because it's not available everywhere, there's still some concerns about it. Right.
Okay.
Yeah. And a lot of these things are very specific brands, and those specific brands are very expensive, and there's not a generic version yet because it hasn't been around long enough. And so all of those things really play a role in who has access in the first place.
Yeah.
Yeah.
To break down what Dr. Eddie is saying simplistically, though, so I just want them to know the basis of PrEP is basically keeping you from getting and or spreading HIV.
Not spreading. So you can't.
You just cannot contract it while on PrEP. Is that correct? Okay.
The problem with that also is, for a while, people were just taking it if they were going to go out partying or something like that. PrEP doesn't work that way. PrEP doesn't work that way. It literally has to be in your system for a long time.
Yeah.
Right. And so it used to be 7 days minimum. Right. And so it has to be in your system. You have to be taking it. It has to be part of like your daily routine.
Right.
And then you have protection. If you're not doing it that way, or if you're taking breaks and not being sure about when and how much is in your system, that's where you get into really big problems.
Okay.
And so that's an important one.
Yeah.
Yeah.
I will say I was on PrEP for a very long time while working in the industry. The only reason I took myself off is because it was hard on your kidneys, and it wasn't necessarily approved for women at the time when I was taking it. So now I know that there's a different strain that might be a little easier on the kidneys. But
so there have been a lot of changes, and so a lot of the new drugs are a lot better on the kidneys. There is kidney impacts as you go when you take any drug,
of course,
but they are getting better as we go, and so new ones have come out like Odefsey and stuff like that are drastically better on the kidneys as opposed to the older ones like Atripla and stuff like that.
Right. Well, that's good to know. So if you can get on PrEP and you are sexually active, I think that would be a good option for you.
I think it's a really, really good and smart option.
Yeah.
And it gives people a lot more control depending.
Yeah. And I think for the longest time, people really thought it was only for the gay community.
Sure.
Only gay men are using PrEP, which, I mean, why would that be the case? Because it's not like gay men are the only people getting HIV.
Well, depending on what country we're talking about, some countries claim that no gay people live there. So that's
Okay.
And in other countries, the majority of people that have HIV aren't the gay community.
Yeah.
Right. Or men that have sex with men, which
Yeah.
is all encompassing. Right.
Right.
And so those communities are different depending on what country we're talking about. Here in the US, it's very LGBT kind of focused.
Yeah.
Less L, but yeah. And so I think those are really important pieces because it's going to depend on where you are.
Yeah.
But getting on it, I think, is really important, and
Yeah.
protecting ourselves. What I will say on the flip side, and the last thing I want to say, is that if you do have HIV and you are on your medications, you also can't pass it to another person.
Right.
But you have to be really good about taking your medications every day and
Is
on
it
the
a
right
timely
schedule.
thing, kind of like a birth control? A birth control is like same time every single day.
That's what they strongly recommend.
Okay.
And so, that's the go-to.
Right.
If you're off by a few hours, it probably wouldn't have the same impact. But you want to take it every day. If you're on a one pill or on a multiple pill or multiple times a day, depending on where you are, there's like a whole chart of different drugs depending on where you are.
Yeah.
And so.
Awesome. Very good information. And I hope we got to all of your questions, you guys. And please keep them coming. We love answering your questions. And if you like what you saw today, click that little subscribe button. And we'll see you next time. Adios, guys.